Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Okay guys, let's continue our review of the official 2025 ICD-10-CM coding guidelines. We are down to number 13 and we're talking about routine and administrative examinations. Let me double check my handout. Yep, just refer to the guidelines first. But I've got a note here, my purple notes are Codemaster Coach notes that says, think about the purpose of the examination. Why is the examination being performed? Up to this point, I have asked you not to memorize, but to think about the letter most of these diagnoses start with so that you have an idea of what's going on with your patient. So when a code starts with a Z, a letter Z, know that these codes identify purposes for healthcare resources, such as examinations, but not necessarily diagnoses where something is identified. So again, in these encounters that start with the Z, the patient is needing the assistance of the physician or the healthcare provider, but there's not necessarily something wrong with the patient. So let me refer you to the guidelines. It says the Z-codes allow for the description of encounters for routine examination, such as a general checkup or an examination for administrative purposes, such as a pre-employment physical. Think about truck drivers. In order to get a job, they have to go through a pre-employment physical. That physical just says, are they in the best of health to drive? Now, the codes are not to be used if the examination is for diagnoses of a suspected condition or for treatment purposes. So see the difference? When nothing's wrong and you're just going in for that pre-employment physical, you're still using healthcare resources, but there's not anything necessarily wrong with you. And if it's for diagnoses or a suspected condition, then it wouldn't be a Z code. In such cases, the diagnoses code is used. And during a routine exam, should a diagnosis or condition be discovered, it should be coded as an additional code. So you're coming in for that pre-employment physical, which is a Z code, and then they find something, then we need to also code whatever that additional diagnoses. I hear a lot of people say their blood pressure was too high, so their hypertension, we have to capture that. Now, pre-existing and chronic conditions and history codes may also be included as additional codes as long as the examination is for administrative purposes and not focused on any particular condition. Because if that care is primarily for a particular condition, it comes out of an examination and the diagnosis code is used instead. This guideline goes on to say that some of the codes for routine health examinations distinguish between with and without abnormal findings. Code assignment depends on the information that is known at the time of the encounter. That's what's being coded. So if you're coming in with pain in your hand, not realizing that your hand is fractured, and if the physician cannot tell just from his physical exam, his history exam, and you're just coming in for pain in hand, then that's all I can code. But if you're referred for x-rays and you end up coming back because the hand is fractured, then and only then can I code the fractured hand. So again, some of the codes for routine health examinations distinguish between with and without abnormal findings. Code assignment depends on the information that is known at the time the encounter is being coded. For example, if no abnormal findings were found during the examination, but the encounter is being coded before test results are back, it is acceptable to assign the code for without abnormal findings. And when assigning a code for with abnormal findings, additional codes should be assigned to identify the specific abnormal findings. Preoperative examinations and pre-procedural laboratory examination Z-codes are for use only in those situations when a patient is being cleared for a procedure or surgery and no treatment is given. So again, pre-op exams, pre-procedure labs, those are Z-codes, and those are to be codes are to be used in those situations when you're being prepared to be cleared for surgery. The Z-code categories for routine and administrative examinations are Z00, encounter for general examination without complaint, suspected or reported diagnoses; Z01, encounter for other special examinations without complaint, suspected or reported diagnoses; Z02, encounter for administrative examinations except Z02.9, encounter for administrative examinations unspecified; Z32.0, encounter for pregnancy test. All right, let's make sure we covered everything at 13. Yes, 14 miscellaneous Z-codes refer to the guidelines. So let's see what 14 says. The miscellaneous Z-code captures a number of other healthcare encounters that do not fall into one of the other categories. Some of these codes identify the reason for the encounter. Others are for use as additional codes that provide useful information on circumstances that may affect a patient's care and treatment. Think about prophylactic organ removal. It says here, for encounters specifically for prophylactic removal of an organ, such as a prophylactic removal of a breast due to a genetic susceptibility to cancer or a family history of cancer, then the principal or first listed code should be a code from category Z40, encounter for prophylactic surgery, followed by the appropriate code to identify the associated risk factor, such as genetic susceptibility or family history. So again, looking at this, if the patient's coming in, there is nothing wrong with this patient. Patient does not have any type of malignancy, but there may be a family history of it. So to be on the safe side, the patient has chosen to go ahead and have those organs removed so that there is not a chance in the future of that malignancy coming on them. Then in that case, Z40, encounter for prophylactic surgery, followed by an appropriate code to identify the associated risk factor. I'd also use an additional code that says genetic susceptibility or family history. All right. If the patient has a malignancy of one site and is having prophylactic removal at another site to prevent either a new primary malignancy or metastatic disease, a code for the malignancy should also be assigned in addition to a code from subcategory Z40.0, encounter for prophylactic surgery for risk factors related to malignant neoplasm. Now notice it says a Z40.0 code should not be assigned if the patient is having organ removal for treatment of a malignancy, such as the removal of the testes for the treatment of prostatic cancer. In that case, we're going to code malignancy of the prostate, not the Z40 code. All right. Now your miscellaneous Z codes for 14, which is on miscellaneous, is exactly what it says, your miscellaneous Z codes. Z28, immunization not carried out, except Z28.3 under immunization status. Z29, encounter for other prophylactic measures. Z40, encounter for prophylactic surgery. Z41, encounter for procedures for purposes other than remedying health state, except Z41.9, which is encounter for procedure for purposes other than remedying health state unspecified. Z53, person encountering health services for specific procedures and treatment not carried out. Z72, problems related to lifestyle. Now it's got a note, these codes should be assigned only when the documentation specifies that the patient has an associated problem. Z73, problems related to life management difficulty. And the note here says these codes should be assigned only when the documentation specifies that the patient has an associated problem. Z74, problems related to care provider dependency, except Z7401, bed confinement status. Z75, problems related to medical facilities and other health care. Z76.0, encounter for issues of repeat prescription. Z76.3, healthy person accompanying sick person. Z76.4, other border to healthcare facility. Z76.5, malingerer, which is cautious simulation. Z91.1, patient non-compliance with medical treatment and regimen. Z91A, caregivers non-compliance with patient's medical treatment and regime or regimen. Z91.83, wandering in diseases classified elsewhere, like dementia. Z91.84, oral health risk factors. Z91.89, other specified personal risk factors not elsewhere classified. Now there is a note there that says persons with potential health hazards related to their socioeconomic and psychosocial circumstances documentation by clinicians other than patient's provider, to go back to section 1B14 for Z55 through Z65. And that leads us down to 15, which is straight from the guidelines, okay? Let's see what 15 says. Non-specific Z-codes. Certain Z-codes are so non-specific or potentially redundant with other codes in the classification that there can be little justification for their use in the inpatient setting. Their use in the outpatient setting should be limited to those instances when there is no further documentation to permit more precise coding. Otherwise, any signs or symptoms or any other reason for the visit that is captured in another code should be used. And when I think about those non-specific Z-codes, I think of patients that are coming in for problems with like a hip replacement. They've already had the hip replacement and now they're having contracture of that hip replacement. If they're coming in for a problem with the hip replacement, then when I code whatever the problem is, contracture of an artificial hip, then I won't need to use an additional code that says, oh, by the way, patient status, hip replacement. I've already identified it in another code. So I hope that makes sense for you. And non-specific Z-codes or categories include Z02.9, encounter for administrative examinations, unspecified. Think of police confinement. And when they capture the inmate, he always says he wants to go by the emergency room because he feels like he's been abused. Okay, Z04.9, encounter for examination and observation for unspecified reason. Z13.9, encounter for screening, unspecified. Z41.9, encounter for procedure for purposes other than remedying health state, unspecified. Z52.9, donor of unspecified organ or tissue. Z86.59, personal history of other mental and behavioral disorders. Z88.9, allergy status to unspecified drugs, medicaments, and biological substances status. And Z92.0, personal history of contraception. So those are 15 miscellaneous. Okay. All right, we're going to stop there because we are going to wrap up the first section of the guidelines in my next video, where we're going to discuss Z-codes that can only be principal or first listed diagnoses. We're going to go into social determinants of health. We haven't gotten a whole lot done in that area, but it's coming. And those are the last two sections of the first chapters of the official coding guidelines. Now there is one more chapter, chapter 22, that has been added to ICD-10-CM, which are the vaping-related disorders and the COVID-19, as well as post-COVID-19 conditions. So we got those two areas to cover before we go into the selection of principal diagnoses, which is section 2. So my next video will be completing section 1. So in the meantime, start looking at those Z codes that can only be a principal or first listed diagnoses. All right, guys, thanks. I'll see you in the next one.